Welcome back, my friends, both old and new. So these are the stairs I'm going to be using to get my stamina back, because the last 6 months of near inactivity has caused some inability to walk multiple flights without getting winded. So those are the steps that I'll be taking. As far as the catheter is concerned, it's been out now for, so it's 3:30. It's been out now about 29 hours, 27 to 29 hours. Overnight was interesting. Had to, first after being in the hospital for 6 days with 2 ER trips as the beginning and end. The catheter's out for, let's say, 30 hours. I'm going to put on the video title 30 hours. And I slept from 6 p.m. to 2 a.m. I woke up at 2 a.m. and then it was a little rough for me. Every 30 minutes I felt as if I had to get up and use the bathroom. And every 30 minutes I got out of bed and wondered if this is the time it's going to jam up, because this has been the history. And each time it's done its best job to get out of there, and I think that there's some issues that none of the doctors mentioned, other than just saying in general having a catheter for 6 months, is a detriment in every way. But they don't talk about the beginning of the tube and where it goes through the urethra and through the male's member, and I think that has been the issue. Of course, there was a lot of blood that blood clots, not fresh blood, that came out with the bladder wash. So I don't think I've heard this type of therapy. I'm going to change the title to this video to New Therapy for Post-Operative Prostate Surgery Issues in Men. And I'm going to put out that the standard fare of you'll be bleeding debris and you'll be blood clots and in the urine, I'm not sure I understand why that's a risk. If people can leave the hospital and they can urinate with strength, then they are the exceptions that should be let out without any issues. But trying to get a strong urine flow right now, in the youth, that's not there. And if it's not there because of complications from having a catheter for 6 months, and by the way, it's not one catheter, it was about 10, so we'll go into that sometime. But the reality is the stream is weak, but the stream is there. So I think that its recommendation from this video is that after a prostate surgery, it seems that everyone would need to come in or stay on saline washes of the interior of the bladder, urethra, and prostate, because if blood clots are going to be, and debris, sediment, and infection are all going to be coming out of the body, that's painful, that's difficult, that causes problems, complications, repeat ER visits, doctor visits ad nauseum, infections. Seems to me that after every prostate surgery, at least the old-fashioned term, there should be a callback a week later to do bladder washes, or even a day or two, or maybe just stay on them until there's absolutely no clots, no signs of blood for 24 to even 36 hours. I mean, why does it not make sense? It's like a car transmission in the old days. You take out the filter, there's kind of sediment and other metallic pieces in your fluid. You dump the fluid, you clean your plan, you put a new filter on, you fill it up with transmission fluid, and if you're a truist, you drain that, you take that filter out too, at least clean it off, put it in new. And that seems to be what they need to be doing with prostate patients. Why have painful urination? Why have blood? Why have sediment? Why have debris, dead tissue? Why have that coming through the penis? Why? Why torture men? Somehow, I have been spared from the misery of the people that have said that they had all this pain and difficulty urinating for a month or two or whatever. All seems avoidable because I'm now not experiencing any of that. So from experience, saying to this audience and to whoever's going to listen, especially if there's a urology doctor or any doctor, why put men through that? They bladder washed me for 24 hours. I watched debris come out. A cystoscopy was done 3 days later or 2 days later. Cystoscopy, whatever the fuck it's called, cystoscopy, showed that there was blood clots in the bladder. Right? Not blood, but blood clots. So, what are they still doing there? Why would you still want them there? This seems to me should be the strategy going forward, and I'll put that in the description, see if it picks up, and mention it again as these videos start to fade. Like and subscribe. I only 194 subscribers. It doesn't make any sense. I need 1,000. Thanks.